Dr. Ronny Tan. I'm a consultant urologist and andrologist from Singapore, Mount Elizabeth Hospital. Men who come to us for urological issues, a lot of times it's because of urinary issues. So in terms of urinary issues, a lot of them will present with either a slow stream or waking up at night to pass urine, which is actually affecting either their sleep quality or even their partner's sleep quality. In terms of sexual dysfunction, some patients come to us because of erectile dysfunction, premature ejaculation, and in some cases even penile deformities like curvatures that actually affect their sexual function. So a lot of times for men, in terms of the slow urination, as we age, this is due to prostate enlargement. And of course, patients who have read up online about prostate enlargement, they also worry about things like prostate cancer. So their concerns when they come to us will be, oh, doc, if I'm not able to pee properly, is it because I have prostate cancer, or is it because my prostate is enlarged? So I will then explain to them that with age, our prostate does increase in size, causing what we call benign prostate hypertrophy, which is a non-cancerous growth of the prostate. At the same time, as a man grows older, his chance of having prostate cancer also increases. And when we talk about sexual dysfunction, for example, the most common erectile dysfunction, where the man is unable to sustain his erection for satisfactory sex life, a lot of times with age we find that the incidence of that happening also increases, and we also want to find out whether he has any hormonal issues like testosterone deficiency. A lot of times men find that everything is okay, they don't come to us. But when it hits them in the bedroom, they find that it really affects them and their partner. That's when they start coming to us. And of course, the other problem, like I mentioned, will be urinary dysfunction, where they actually wake up at night to pass urine. They find they're taking longer to pass urine. So I would suggest that any patients who have any urinary symptoms to seek attention with the urologist, because other than the causes that I've mentioned previously, like an enlarged prostate, we also worry about things like prostate cancer and even bladder cancer, especially if the patient presents with blood in his urine. Talking about benign enlargement of the prostate, or BPH, treatment always starts with lifestyle modification. We have medications that help the patients. Other than medications, we have surgeries, and in the recent years, there's also minimally invasive treatment techniques. So surgeries will include things like TURP, which is transurethral resection of the prostate, or even using the green light to vaporize the prostate. For the minimally invasive techniques, these will be treatments that are day surgical procedures, and they are less involved as compared to TURP. So examples will be the urolift treatment or the resume treatment. And in terms of the treatment of erectile dysfunction, we typically start with some medications to improve erection for patients, other kind of adjunctive treatments like injectables. We have vacuum erection device to help patients. And lately, we also do things like low-intensity shockwave therapy to improve the circulation to the penis, as well as cause regeneration of nerves to improve the patient's erections. At the end of the day, the treatment that will definitely help the patients to get back their erections will still be surgery. But of course, before considering surgery, all the other treatments will still be given to the patient before. Let's start with benign enlargement of the prostate. So medical treatment with oral tablets is always usually the first line. Of course, some of the medications do have their side effects. And I will look at the age of the patient and whether the patient still wants to be sexually active and whether he's acceptable to the possible side effects of the oral medications. Because sometimes the oral medications can cause either erectile dysfunction or even ejaculatory dysfunction. And also there are also younger men in their 50s who feel that they are not ready to be on these medications for long term. So in those cases, I will then approach the use of minimally invasive treatment methods. The normal surgical techniques like TURP is still suitable, but the problem is it will result in retrograde ejaculation, which some sexually active men may not be acceptable to. And we know that the prostate continues to increase in size even after the resection. So for younger patients, we will then ask if the ability to ejaculate is important. If he feels that that sexual function is important to him, we will then discuss treatments like urolift or resume treatment. Other than medications that we can give to the patients, we also perform the minimal invasive surgical techniques like I mentioned, urolift surgery, and resume surgery, which can be done in our hospital. Well, at Mount Elizabeth Hospital, we do have other subspecialties that we can work with, because some patients, when they come to us for sexual function, if we find that it's due to psychogenic cause, we might even get our psychiatrists or psychologists to counsel the couple if needed. Then if we do find some organic cause, for example, very complicated hormonal issues, we have other subspecialties that we will get them involved so that we get a wholesome treatment for the patient. We can't prevent the prostate from getting enlarged, because as we grow older, it is known that the prostate will enlarge in size. I think the important thing will be for men to step forward and get themselves checked. If, for example, there are difficulties in the bathroom, but having difficulty passing urine. So get it checked earlier so that the kidneys will not be involved, because we know that if a prostate problem is not treated, it can affect the bladder and even the health of the kidney. In terms of sexual function, there's no need to be embarrassed, because there are always treatments available. So we also encourage patients to have a healthy lifestyle. If smoking, try to quit smoking, because we know that smokers are always at higher risk of having erectile dysfunction. And stay active, exercise, and then should there be any issues, just come and see the friendly urologist who will take care of him.